I'm tackling Ebola from a Pan-African perspective, considering the lack of Afro-initiated drugs and vaccines on the scene ever since the onset of this health menace. I understand that there is a school of thought that we do not have the funding, the capacity and the resources to carry out quality biopharmaceutical research, but I would like to disagree with that. I would like to say that we are able, we have the breadth of experiences and we have the number of people. We have qualified people who can carry out such research. So what I am calling for in this fight against pathogens such as the Ebola virus is a coalition, is intra-African research, forming collaborations between different African countries so that we can tackle our common problems together. Now, I'm going to conclude by saying that in our bid to control and manage Ebola by closing borders, it is essential, it is imperative that we open up communications between ourselves and we begin to form those collaborations. We can draw from our ties to the West and we can get closer to our solution, because that is where the African future lies.
My name is Kusema and I'm an urban planner. As an urban planner, I'm inclined to think about the ways Ebola is and will affect cities and urban governance, as well as the reverse, how urban governance is affecting the spread of the epidemic. So Ebola started in the remote provinces and rural areas of West Africa, in small villages where the low density and the isolation of the population actually aided with containment. But as we've seen over the past couple of months, Ebola has spread to cities, to Freetown and Makeni in Sierra Leone, to Monrovia in Liberia, and to Port Harcourt and Lagos in Nigeria, just to name a few. As has been noted by many, once Ebola gets into cities, it takes on a whole new dimension. Our cities in West Africa, especially the largest ones, are often crowded and chaotic, marked by informal urbanization and oftentimes a lack of basic services. In many instances, the resulting realities from these conditions is making our cities hotbeds for the spread of the Ebola virus. The fear that Ebola has incited is rampant, understandably so. This is a fear that I think at its core is grounded in a lack of faith that the government and its often entrenched elite at the higher levels will have the best interests of vulnerable populations in mind. A fear that, unfortunately, especially when you look at the way in which we've villainized poverty in so many of our cities, is not completely unwarranted. So, though I'm not able to offer a holistic solution to defeating the virus, the piece I want to contribute is that our solutions must sort of be cognizant of this deeply broken trust between many Africans and our leaders and the governments they represent. And so these solutions must avoid deepening the wounds.
The first case of the Ebola crisis that was reported in West Africa was on September 22, 2014. And between that time and now, we have had over 6 months that have transpired and several lives have been lost in the process. As a matter of fact, the WHO has reported that about 3,400 lives have been lost as a result. I think we should pause there for a second. 3,400 lives have been lost. It's so easy for human lives to become mere statistics, but what is even more unacceptable is that African governments have not stepped forward to the plate. We keep throwing up the cliche excuse of lack of funding and lack of resources. But if countries like Cuba could send over 100 medical personnel of doctors and nurses, countries like Malaysia could send millions of hand gloves, medical hand gloves. What excuse do we have as African states, which are at the core and at the center of this crisis? South Africa has made promises of sending funding. Kenya has made promises of sending funding. Nigeria, which is a success story, has made promises of sending personnel, but none of these have materialized. It's unacceptable that it was only in August that the African Union Peace and Security Council made its first statement on the Ebola crisis. This is a council that is mandated for responding to humanitarian crisis on the continent. I think it's about time that African leaders take a step forward and stop this issue of rather, instead of responding to the crisis, we're blocking off our own borders to one another. As the African proverb says from Tanzania, 2 ants can successfully pull a grasshopper. So no matter how daunting this task might seemingly be, I think the best way to move forward is to join hands together with Liberia, with Guinea, with Sierra Leone, and let us show them that as Africans, we can overcome this and not just totally rely on the West, and by so doing, increasing the level of disrespect for Africans on the African continent.
My name is Amatayo, and I wanted to talk about how Ebola has affected the African economy. First of all, when the Ebola epidemic started, a lot of countries closed off their borders, which stopped assistance from going into some countries. Like Liberia, for example, has become essentially a war zone because everyone's trying to run away and, flee, I guess, their homes because sick people are there. They don't want to contact the sickness, which is pretty understandable. And actually, a lot of people around the world have cancelled their travel plans to Africa just because they don't want to get sick and they're trying to protect themselves, which has, I'm sure, put a huge blow on the tourism infrastructure. And speaking of people around the world, it's so easy to, because this thing started in Africa, or this particular epidemic started in an African country, a lot of people just think African and think Ebola. A bar in Korea, for example, posted a sign outside of their door banning all Africans from the bar, and they literally stood there and checked everyone's IDs to make sure that no African was coming in. Of course, the manager apologized for this afterwards, but the deed was already done. Even as Africans ourselves, we make jokes all the time about, oh, don't bring Ebola, I hope you didn't bring Ebola here, or I will greet you from a long distance, or eat garlic so people run away from you, I will not greet you. And I'm not saying that I'm not guilty of some of these jokes myself, but I think the better thing to do would be to practice careful and clean hygiene, like washing your hands and making sure that you don't come in contact with the dead bodies, or just protect yourself from like ritual or funeral rites of someone who died from Ebola, and don't try to touch infected things that you think might be infected from Ebola, or like stay away from blood and body fluids. And I think some of these things would be really helpful to keep us all safe from this horrid epidemic affecting our people.
First of all, I would like to acknowledge the efforts of doctors, nurses, and all healthcare delivery workers who have worked tirelessly day in, day out in the most recent outbreak of the Ebola virus disease in Africa. I would like to honor the memories of those who have lost their lives. I pray that God comfort their families and God rest their souls. But moving forward, I would like to emphasize the fact that the healthcare system in Africa, in most African countries, is still very, very poor, very weak. Why am I saying this? Ebola virus disease has been a problem in Africa for a very long time, and one would expect that at this point in time, we would have had a minimal standard for handling this crisis. But you wouldn't believe that it was at the point of this most recent outbreak, which has been described as the worst ever in the history of outbreak, new hospitals were just being built to manage the Ebola virus disease, and I believe that is simply not good enough. Vision, foresight, and effective implementation. These are the 3 major things I believe are always acting against leadership, especially governments in Africa. Finally, I believe that if we are able to move forward from this Ebola virus disease, we should also look into the possibility of setting a minimally accepted standard for handling of future crises. Ebola virus disease is just one thing. Who knows what's coming at us next? But if we're not prepared, if we don't have the planning, if we don't have the vision, we will always be on the back foot. And this, I believe, could be the starting point into getting effective healthcare system set up and running in Africa.